Bonnie, welcome back to Central Valley Talk. It is St. Patrick's Day. Happy St. Patrick's Day, the 17th of March. I'm Austin Reed, coming to you live on YouTube TV, Facebook, Instagram, and of course our home, CentralValleyTalk.com. Hit me up on Facebook, Austin Reed on Air, also on Instagram and Twitter. You know, some of the things that we like to talk about here on CentralValleyTalk.com is new websites that are going to change the world. And I have one idea for you. Joining us live via Zoom right now is Micah Jerrell with PatientCareGuide.com. Micah, hello there, and happy St. Patrick's Day.
Happy St. Patrick's Day to you too, and thanks for having me on Central Valley Talk. I appreciate it.
It is our pleasure. We know each other, and I really am excited about PatientCareGuide.com. Not sure as excited as you because you helped launch this.
Yes. Yeah, and this is an idea that's been in the making for about 7 years with someone that I worked with in the past. So I'll kind of explain why this is needed, and it's something that we didn't realize we need as a general public. In regular everyday life, we're overwhelmed with information. As a matter of fact, scientists say that if we were to process all the conscious and subconscious information every day in our brains, and our brains were a computer, our brains would crash in a week. So how does our brain handle all of that information instinctively to preserve ourselves? We go through informational gateways. Like if you had a question, you'd probably go to Google to look up the state capital of North Dakota, Bismarck.
Sure.
If you wanted to go to a restaurant, your informational gateway would be Yelp. If you wanted to buy an RC car, you'd probably go to Amazon to look at the different options. So that's everyday life. Now let's talk about the stressful situation of being in a hospital, which most of us don't plan on being there. Mm-hmm. And that's very stressful. We all have family, friends. We've maybe been there ourselves. And there are 36.5 million Americans every year that are hospitalized. And then a third of those people will need what we call continued care. It could be inpatient rehab. Maybe we're in a car accident and we need to get, legs broken. We need to get rehabilitation, or you need to get home health. What's our informational gateway for that? We haven't had that. And that's the idea behind Patient Care Guide, is to be a gateway of information and informed choice to match up the millions of Americans every year that need that informational resource to work with their case manager in the hospital, and then the tens of thousands of providers nationwide that have services that match up. And a lot of times we're not getting the exact best matchup for what we're needing. So that's the idea behind Patient Care Guide.
So how long has Patient Care Guide been around now?
It's been a year, and we went through our final beta testing. We're working with case managers who they're kind of behind the scenes in hospitals. Whenever the physicians that are managing you or your family say, you're going to need some home health. They'll pass it off to the case manager, and the case manager coordinates with what we'll call post-acute providers. So home health, inpatient rehab are the most common, or we might have elderly family members that might need to go to a skilled nursing facility for 4 weeks of IV antibiotics for an infection they have in their foot. So the case manager handles that, and they're a very overwhelmed group. So to kind of jump back to some other experience I have, I'm a registered nurse, and I worked with patients, and that's going to be your closest bond in a hospital, is the patient and the nurse. That's who you're going to ask questions. And honestly, there's no training for the bedside staff on those questions that we're getting from patients about what is home health? What does that look like? I had no idea what it looked like. So I wasn't able to be a resource. It was totally dependent on the case manager who's covering 30 patients in the hospital and they're spread thin. So this is something that the patient care guide will help the case managers work with the patients, make an educated, informed choice in where they're going to go.
Well, yeah, I mean, I've got cystic fibrosis, as you know, and a lot of our audience knows. And I remember dealing with situations right before I was to get out of the hospital and I needed maybe an infusion or, whatever. And I experienced that multiple times where the nurses really, they don't know. They don't have the answer.
Right. And as a nurse, you're put in that difficult scenario, kind of being the bedside quarterback, but you're so busy with everything that you try to learn, and you'll learn as you go, but there's no real resource for it. There's no Amazon for information to let you know what's going on. And I think that a lot of, I used to joke about this to kind of lighten it up, but a lot of times the patient is the last person to know what's going to go on in their plan.
Right, so in their care.
Whenever you're in the hospital or a family member's in the hospital, a lot of times the patient's the last one to know what's going to go on. And the best analogy I have for that is, it would be like me coming into my family and saying, we're going to go to Florida this weekend on vacation. And that's it. And then you have all these questions. I'm sure my wife would, with, what town is it? Is it on the beach? What does the place look like? And our brain wants pictures. And a lot of times that's what discharges are. It's like that, walking in and saying, here's where you're going. Here's your option. And then that's it. Good luck. See you later. Here's one piece of paper.
When it's such a scary time as well. I know we've had these conversations on the phone where it's like, it's so stressful for not just the patient, but for the family. Right.
And it's a great tool for families to be able to support. A lot of us live in different places where, you might have a mom, a mother-in-law, an uncle that lives 2 states over. How can you help? And it's really helpless when it's that helpless feeling of, I can't really do anything other than calling that overwhelmed case manager to help mom.
Right.
So it's another resource to help the family be a part of that transition, to be able to support.
Another thing I want to talk about is the website itself. It's beautiful. It's easy to use. Kind of walk us through, though, more.
Okay. Right now we're working on, since it's in its infancy, getting it would be like in Yelp, having the restaurants put their menu on there. We're working with the home health companies nationwide, inpatient rehab, long-term acute care hospitals, hospice, skilled nursing facilities. There are 33,000 nationwide, and I was surprised with how many there actually are. I knew about the post-acute space, but I didn't realize how many there were. And they're busy out there marketing, again, with that case manager who's overwhelmed, managing a lot of patients, and then they're getting calls from families, and then they have these home health companies dropping off different information. And it helps them build it up. So we're building up. The site right now is wood frames, and we're putting the brick on the outside and the insulation, with the profiles being built out to where us as patients or family who might be a patient can actually go in there and connect the dots more easily than just hitting. This is one place where going to Google and saying home health, Denver, where I live, you just get scattered information on there, and then you end up just kind of giving up. So that's where we're at now. But if you go to patientcareguide.com and you live in Fresno, you'd be able to put in your zip code, and then all of the home health providers that can provide for your county, it's all linked to where your zip code is, will pull up. And then you'll be able to see insurance. What are their specialties? What's their story? What's their phone number? Is there a representative, a clinical liaison that I could talk to and ask questions? And you can do this all anonymously, which is unique. Some of the sites that are out there now, you have to put in your phone number, your name. You don't have to put your social security number, but it feels like it. And then you'll get all kinds of calls. You can do this anonymously whenever you'd like. And if you see a provider that you like, you can share it. You can text it over to family. You can, remember it however you'd like on that, but it's very interactive. It gives a picture.
Right. And right now you've got pictures of the facilities. I know the goal is maybe to get some videos on there, or some of the hospitals or some of the health centers can send in, really nice virtual tours. So this thing is it's gonna blow up, and there's nothing else really like it, right?
There's not.
Wow.
There's nothing that's like it that's for the entire post-acute space, where you're able, and that's the idea behind it, is to have it be the informational gateway, to be a third party. It helps out hospitals, because Health and Human Services, or CMS, the Medicare and Medicaid, they're very bold about making hospitals give patient choice, but it just hasn't happened yet. So it makes CMS happy. It helps the hospitals. It greatly helps the case managers, and it definitely helps the patients and families.
We've got
so it's matching up.
Okay, we've got about a minute left.
Okay.
Anything else that I missed? Anything else you want to get across to our viewers?
No, just Patient Care Guide is the gateway for an informed choice for the millions of Americans that will need an informed choice to match up with the tens of thousands of post-acute providers out there. So thank you so much for your time today.
Absolutely, Micah. Thank you. And if somebody has questions, they can find you on patientcareguide.com, right?
And then it's info@patientcareguide.com. And we'd be more than happy to answer any questions you have.
Info@patientcareguide.com. Very easy.
Yes.
All right. Come back anytime, because I want to learn, and I want to follow this, as you guys are just a year old, and I want to see where it goes.
Great. Thank you so much. Yeah, we're excited.
Yeah. By the way, isn't it really snowy in Denver right now? Is that where you are right now?
I'm actually traveling.
Oh, you are traveling. Okay.
My boys are having to shovel the snow, but we got a couple feet of snow.
I know. I saw that. I was like, oh my gosh, I'm in a historic March storm.
Yeah, it was. So it was nice to be out of town.
Yeah, I know. You picked the right time to get out. So, all right. Micah Jerrell, RN with Patient Care Guide, and the co-founder. Thank you for joining us.
Thank you, Austin. Have a great day.
All right, you too. I'm Austin Reed. You're watching Central Valley Talk. We're back with a St. Patrick's Day segment in just a few minutes. Stay tuned.